Bismillahirrahmanirrahim. This video is about the important multiple choice questions related to the percentages of 30 to 40%. Okay, so let us start this video. Okay, so how much is the percentage risk of chromosomal abnormalities associated with IVF? That is basically 30%. Now, the risk of pregnancy loss after intrauterine blood transfusion is that is 30%. Next, how much is the risk of superimposed preeclampsia in chronic hypertension? That is 35%. Now, how much is the rate of congenital anomalies in IVF? That is 30 to 40%. Okay, and the next question is, how much is the percentage of successful outcome in case of the molar pregnancy with the twin? That is 40%. Okay, so these are basically few questions which come in the range of 30 to 40%. Okay, we still have some time, so it would be better if we do revision. While in revision, I would like to revise the previous percentages before 40%. Okay, so as we studied, what are the percentages, what are the cases in the percentage of 0 to 10%? First of all, rate of developing post-hysterectomy ward prolapse is that of 6 to 12%. Incidence of women being pregnant after diagnosis of CA breast is less than 10%. Percentage of the twins to deliver before 32 weeks is that of 10%. Risk of schizophrenia to the baby if father is positive is 5 to 10%. Incidence of the primary ovarian insufficiency is 5%. Risk of the endometrial cancer in women with a postmenopausal bleeding is 5 to 10%. Percentage of the women having surgical site infection is 5%. Asymptomatic bacteriuria occurs in 4 to 7% of the cases. Percentage of the people requiring insulin during labor is 10%. Incidence of the HELLP syndrome is 2 to 4%. Recurrence risk of the HELLP syndrome is 5%. Incidence of the true knot is 1%. And the risk of the vaginal prolapse in the woman is 50%. The risk of the twins with clomiphene citrate is 6 to 10%. Incidence of the perinatal injury with the forceps is 8 to 10%, and with the vacuum it is 1 to 4%. Incidence of the UTI in pregnancy is 8 to 10%. Asymptomatic bacteria occurs in 4 to 7% of the cases. Percentage of the women who are offered the choices of the perinatal testing is 5%. Overall risk of the serious complication following DH is that of the 4%. Percentage of the people developing bacteriuria with a pyelonephritis is 15 to 25%. Incidence of the grade 1 meconium stain liquor is that of the 5 to 10%. Now, what are the incidences in the 10 to 20% cases? Likelihood of the malignant change in complete mole is 15%, and percentage of the variant of the Willebrand disease is 13 to 18%. Risk of recurrence of the pyelonephritis is 10 to 19%. Percentage of pregnancy-related death caused by infection is 11%. Risk of the abnormal uterine bleeding with the von Willebrand disease is 13 to 16%. Incidence of the chronic pelvic pain in a woman of the reproductive age group is 15 to 25%. Incidence of the meconium aspiration syndrome is 10 to 15%. Meconium staining in post-8 is 30%. Meconium aspiration in post-term is 50%. And perinatal mortality in patients with placental abruption is 20%. Incidence of the superimposed preeclampsia plus chronic hypertension is 25%. Reported incidence of the psychosexual disorder is 20 to 30%. Percentage of chromosomal abnormality associated with omphalocele is 30%. Percentage of chromosomal abnormality associated with hydrops is at the 20%. Percentage of the triplets delivered before 32 weeks is 27%. And the recurrence risk of acute fatty liver of pregnancy is 25%. A risk of the HIV transmission from mother to baby is 25 to 30%, and it is 40% in case of the breastfeeding. Okay, so these are the percentages up to 30%. Okay, as far as the percentages in the 30 to 40% of the cases are concerned, for that you can watch the start of this video. Okay, because the start of the video was basically regarding the percentages of 30 to 40%. Okay, again I would like to advise you that for any percentage question, make a chart. Okay, and write the percentages in a separate place so that you can memorize them in a better way before going for exam. Okay, thank you so much for kind listening. Okay, see you in the next video. Allah Hafiz.